Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
I'm Jim. She's Kay. Good morning, Kay.
Good morning, James.
And this is Health Talk, brought to you by Mon General every Thursday morning here on WAJR. Mon General Hospital has become the first hospital in north central West Virginia to receive full Chest Pain Center Accreditation and Percutaneous Coronary Intervention.
I'm glad you said that.
I probably mispronounced it. But we have three guests in the studio today, and we'll introduce them to you one at a time. Dr. David Lawrence, Medical Director of the Mon General Emergency Department. Good morning.
Good morning, Jim. Good morning, Kay.
We also have Mike Brocious. He's a paramedic with Mon EMS. Good morning, Mike.
Good morning, guys.
And also we have Jimmy Smith, the Assistant Director of MECA 911. Good morning.
Good morning.
Let's start with you, Dr. Lawrence. Tell us what the accreditation means.
Well, the accreditation is given to us by the Society of Cardiovascular Patient Care. What it means is that we have been able to show that we excel or meet all standards of cardiac care. So much like trauma center designation and other things where a accrediting body comes in and looks at each and every one of your procedures. In order to get that, we had to hit benchmarks of our standard of care of what medications we gave people. We had to hit standards of care of our outcomes, standard of care of how quickly we got people to the cath lab and open up their coronary artery. Had to show that we have a public outreach of education and a strong relationship with the two guys here, both EMS and the dispatch system.
Yeah, that was going to be the next question. The chain, everybody has to work together. So when we call 911, we get a hold of the MECA 911 Center. And Jimmy Smith, then what happens from that point in association with Mon General Hospital? When you get that call into the MECA 911, what do you talk to with the patient about?
Well, Jim, when someone calls into 911 and they're requesting an ambulance, first of all, the first thing everybody needs to understand is the person on the phone they're talking to is not actually going to be the person dispatching that ambulance. So they're going to receive a lot of questions. And most people are very anxious when they're calling 911, especially for an ambulance with somebody with a chest pain. And all they're caring about is getting that ambulance to their house. So we want everybody to know that the person they're talking to on the phone is not the one actually that's going to dispatch the ambulance. They're going to be asked a series of questions. Our dispatchers follow an EMD card. It's an emergency medical dispatch card. And with that, they're trying to obtain as much information about the patient as possible so that they can pass that on to EMS who's en route.
All right, Mike Brocious, you're at the Mon EMS facility below the hospital. Mm-hmm. I've been in there, nice facility, fairly new, I think it is. And do you get an alarm or a call? What happens when you're dispatched from MECA 911?
MECA will dispatch us, and we'll get what's called tones over the air, and that tells us we're getting a call. So then we'll just get in our ambulance, and MECA will direct us the address and get us to your house.
How much other information are they providing you besides the address?
Just the chief complaint of what's wrong with the patient, how the age, and possibly any other problems that might be getting to the residents. That as far as getting in the house, or if there's road closures or something like that.
Yeah, anybody who's listened to a scanner at any time, we probably hear a caller complaining of chest pains.
Correct.
Is that what you hear? And
yeah,
so you know what to expect when you get there.
Complaint, chest pains and any cardiac problems or the medical history that goes along with the patient.
And it is important to call an ambulance. Number one, do not try to put them in the car and drive yourself, because once you get that patient in the ambulance, Mike, what happens?
Well, we just we do an initial assessment at the residence, and then we'll get them in the ambulance, and we have the technology to do an EKG that we can send over wireless technology to the hospital help save time, and if chest pain is the major problem.
And the reason that saves time, Dr. Lawrence, is the fact that you get that report, you can start preparing if, in fact, you get that report and know that the patient's in trouble.
That's correct. We actually have what we call a STEMI alert, which stands for ST elevation MI, big old medical talk for it's a clear-cut heart attack that we can see on the cardiogram. So if Mon EMS, or we actually do it with other neighboring EMS agencies as well, sends us a cardiogram and it's clearly a heart attack, we go ahead and do the STEMI alert before the patient even gets to us. So if they're 15, 20 minutes out, even if it's 2 minutes out, it gives us that kind of lead time so that we can, if we have somebody on, we have multiple cath labs, so we can usually clear one up near immediately. And that gives the patient the best chance to have the smallest heart attack that,
Which is the goal.
Right, the least amount of damage.
The big long word that Jim used a little while ago, PCI, that's actually what we know is an angioplasty?
That's correct. That's correct. That's done in the cath lab, and they do angioplasty and or put in stents. And I think everybody these days knows somebody running around with a stent.
We have done health talk shows where we've talked about going from the phone call to being in the hospital and those types of things. Yet I'm still curious to know more about what the accreditation means.
And the importance of it.
Well, the accreditation for us, it means a couple things. One, it lets the general public know that we have gone through the vigorous trial of showing that we're doing everything that is national standard, and you have to meet or excel at that. For us as an individual hospital, it gives us a method and a organization that does benchmarking so that we're sure as trends change throughout the country that they will inform us that now this is the standard, now this is the standard, and we will consistently be above the standard of care. It lets the public know that we've gone through that vigorous accreditation, and they should feel comfortable coming to us for their chest pain.
So you're the first hospital in North Central West Virginia to have this accreditation. So that should tell people in the community that when it comes to health care, as far as, is it just strictly our chest care or heart attack, is that the accreditation covers that, or does it cover more?
The accreditation itself is called a Chest Pain Center. So it would be, and when they delve into what capabilities we have, they're actually looking at our chest pain or heart attack numbers, non-heart attack numbers as well, of how we stratify and how we take care of that. But part of their look-see when they come find us, they look at all of our cardiovascular programs. And if you're aware, we have a very active coronary artery bypass graft surgery department. They also do many valve repairs and valve replacements. We have electrophysiology, which is the defibrillator, pacemaker, and ablation kind of thing. So we are a full-serve cardiovascular center, and it's not just limited to chest pain and heart attack.
Well, it sounds like that's where I want to go. However, if I'm calling Mecca 911, how do you dispatch? First of all, how do you select which ambulance service is going to come to our home and which hospital we go to?
Well, when we get the call in for chest pain, we will tone out. Mon EMS is first due in Montague County, and they actually have two stations. One's located right below the hospital, and the other's located down in Osage at the old Granville Firehouse. And so if it's something on the west side of the river, we're going to notify that station. If it's on this side of the river, the one at Mon General will be notified.
And Mike, if Mon EMS comes to our home and taking us to the hospital, are they always taking us to Mon General?
No, the patient has a choice to go to either Mon General or Ruby, WU Hospital, and it's basically up to the patient.
So what we are doing on the program today is letting our listeners know you do have a choice, but perhaps you want to choose the one that's been accredited for chest pain. And you can just let your paramedic inside the ambulance know, or when you come into the house to assess our situation, take me to Mon General. Take me to Mon General. Is that kind of how it works?
Yeah, basically. Yeah,
okay.
I mean, as long family members, if the patient's unable to tell us, family members, it's all up to the patient.
All right. We're going to take a break. If you have any questions this morning, call us 304-296-0041. It's Health Talk on WAJR. In the studio this morning, Dr. David Lawrence. We have Mike Brocious in. We have Jimmy Smith in. And we're talking about Mon General Hospital becoming the first hospital in North Central West Virginia to receive full Chest Pain Center Accreditation with PCI from whom, Dr. Lawrence?
The accreditation comes from the Society of Cardiovascular Patient Care. And it's an organization that's been around for quite a while. Used to be called the Society of Chest Pain Centers, but now they've expanded their role into more cardiovascular care, including arrhythmias like AFib and things like that. So they've expanded their scope a little bit.
And when an organization is accredited, usually it means for a certain period of time, and then you need to make sure that you're still meeting the standards as the first time you were accredited. So how long does this standing last before you have to prove to them again that you are still worthy of accreditation?
That's correct. The accreditation is for 3 years, but we are in a constant interaction with them as well. So we have to continue to show them data as we go so that we're not falling off pace in the 3 years, just getting it and forgetting it. So they will be back in 3 years, but again, we are continually sharing data with them, and that's part of what the society or the chest pain centers do. I don't know the exact number, but we all share data. So that becomes evidence-based medicine that says, okay, if people in Oklahoma are doing it better, faster, quicker, getting better results, we get that information. And if we're doing it better, faster, quicker, the people in Oklahoma get it. So it's a huge society that does this benchmarking and sharing of data. And that's one of the big assets of becoming an accredited body, is that you're using the whole compendium of the nation's resources.
I'm sure once you have it, you don't want to lose it.
Oh,
That's
no.
for sure.
The good news is we have always been doing what we're doing today. What we did was put it all down on paper, hand it into an accrediting body, and get their nod of approval that says, yes, you are at or above the standard on all of these. So our care at Mon General actually has always been to this standard. It's just that we took the effort to be under the microscope from a national agency to prove that we are doing what we think we're doing.
Jimmy, you talked about that 911 call when it comes to the point we think we need help. And when we do call, again, you take the call, but then you start asking a bunch of questions, and we're wondering, well, we need an ambulance right now. You're scared, you're worried, you're frustrated. Talk about how the process goes.
And Kay, that's so true. And a lot of people don't realize when you call into 911, you're going to get the call taker, and that's the person that's going to get your name, your address, your phone number, what your complaint is. And as you're giving that basic information, they're putting that into the system. The computer, then a dispatcher sees on their screen.
Okay. And you have two people then working together? That
is correct. There's two people actually working at one call, and the second person will then start dispatching the ambulance. So as the first person you're talking to continues to ask you all these questions, the ambulance is now en route. They have been dispatched. And we follow what's called EMD cards. It's Emergency Medical Dispatch. And that call taker is going to ask you a series of questions based on your complaint. And with the chest pain, it's going to be the exact same questions to every patient when they call in. And so we want people to understand this so they don't get frustrated thinking, I just want an ambulance sent. The ambulance is being dispatched by a second dispatcher.
But does your caller taker tell them that so that they can relax a little bit knowing help is on the way, or do they have to continue their process of asking questions?
They will continue their process of asking questions, and if a caller becomes very frustrated, then they will say, we are notifying EMS. We need this information.
Give me a sample of some of the questions. If I call in and saying shortness of breath, tightness in my chest, I'm worried I'm having a heart attack. Can you tell me what some of the questions are that you ask?
Well, if you call in and say you're short of breath, they'll ask, have you been sick? Do you have any medical history? Do you have history of heart attacks?
Okay. So you just want to narrow it down to whether this is a repeat heart attack that the person has had, whether they've been showing other symptoms of a heart attack.
Do you talk about medications at all at that point?
They ask what medications you're on or that you've been taking. They'll also ask if there's somebody there with you to go ahead and gather those medications up so that you can give them to EMS when they arrive, because what we're trying to do is have everything prepared for when the ambulance does arrive.
And Dr. Lawrence and Jim brings up the fact that there's so many different feelings we can have thinking we're having a heart attack, from stress to indigestion, heartburn, all of those things, something we didn't quite set well. When do we know the difference? When do we know that we need to dial that 911 and make that call?
It's really difficult, and it is different between males and females, and when in doubt, you need to get you need to get seen. With the more typical male symptoms I feel like there's something sitting on my chest. I'm short of breath. The statistic that is a little bit worrisome is that when we get people in that have an active heart attack, and we go back retrospectively and we say, have you had anything that sounds like this before? Most people have had something that's been stuttering that they just haven't addressed. So probably that acute heart attack is, it may not be as subtle as you think, but there's probably something prior to that discussion with your family doctor of saying, I just don't have the energy I used to have, or you know what, I can't.
You're going to have little signs,
right,
is that what you're saying?
Right, I can't walk up. I used to be able to walk up 15 steps with no problem whatsoever. Now at about 10 or 12, I get a little winded or I get a little bit lightheaded. So there's subtle things. Maybe, I just don't, I'm more tired. I don't have the energy. I'm a little short of breath. There's little things. It's very difficult, but there's a sense in almost everybody that's having a heart attack. There's a sense of anxiety of, I know there's something different. I know there's something wrong. It may be associated with something in the chest because that's the center of the organ that's bothering you. But it could be, it could be one of anything. It can be nausea. It can be chest pain. It can be shortness of breath. It can be pain going to the jaw, pain going to the arm, pain going to the back. But there's almost always a sense of anxiety that there's something totally different here than my normal state.
Yeah.
And that's probably adequate to call 911.
If someone's listening this morning that's had a heart attack, and they'll say, and I've heard it, if you're having a heart attack, you're going to know it. Pretty much, because you're going to have a lot of pain in your chest. So.
I just need to say that I used to carry my phone in my breast pocket here, but I can't do it anymore because every time it vibrated, I thought, that's my heart. I got to call. I got to call 911.
Just answer it.
I forget I had it in there.
Yeah, that's good advice. Let's not carry our phones in the left front pocket.
In vibrate mode.
Yes.
All right. We're only about 30 seconds left in the program, so we'll go ahead and wrap it up and then take a break and go right into news at the top of the hour. But I guess congratulations are in order for Mon General Hospital for getting the accreditation, and I want to thank you all three for coming in and taking part of your workday out to be with us on Health Talk.
Thank you very much.
Thank you so much for being on the program with us today. Jimmy Smith, Mike Brocious, Dr. Dave Lawrence, our guests on Health Talk. And again, a video of this program, complete with illustrations, as they like to say, will be available on the Mon General website. That's mongeneral.com. Thanks to Bill Sherwin, our show producer, for bringing in our guest today and always coming up on Thursdays from his job as well. For Kay Murray, I'm Jim Stallings, inviting you to stay tuned for Morgantown AM, the talk of the town, coming up after the news on WAJR.
In our